Greetings. My name is Suleiman Diallo. I am pleased to have you today on our Facebook Live for the first time, introducing our New York State Assembly candidate, Mr. George Alvarez, and our candidate for the District 79 main leader, Mr. Amadou Diallo, as well as the public advice health team that we will introduce here. It will be Dr. Arseni Balde, who is an MD, also a nurse, Miss Mariama Bari. We're going to have as well a community leader, Sheikh Musa Drame. With this team, we will be speaking about the corona virus crisis, as well as remedies and what to do to protect our family. As for me, my name is Suleiman Diallo. I am one in chairman of these two candidates. I am pleased to introduce them to you. So we're going to first introduce our main candidate, Mr. George Alvarez for the New York State Assembly, just to say hello, and then we're going to come to the comment in 2 minutes. Mr. George.
Well, thank you very much, Mr. Diallo. Thank you, the doctors and the nurse. Thank you, the district leader candidate. And more than anything, thank you for the Bronx population in New York City. The idea to put together this team is because we are very worried. We are concerned about what's happening right now, not just with the coronavirus, but also on the health situation that is affecting our Bronx and our people. As you may know, the Bronx is #1 in asthma and diabetes, right? Right now is #1 in fatalities in coronavirus, even though we are not the county who has more infection because we are smaller than other counties, but in terms of fatality, we are more propense to have more people die for coronavirus. And that's the idea, is to present the people, the 79 Assembly District, what we are doing to protect them and what is our plan. That's why we put together a team and expert. We have Mr. Musa, who is a wellness solution type of expert. We have the doctor, who is epidemiology, someone who knows the infection, someone who knows what to advise to us. And then we have also a registered nurse working in one of the hospital where she is in the front line right now, seeing everything that is happening, right? And then we have our district leader candidate, Amadou Diallo, which also team up with us. We have Mr. Barrett, which is one of the leaders in the African American community, and also is a pretty good advisor of us in terms of housing and nature. So this is our team that is going to keep advising us before we get elected and after we get elected the assembly seat. So that's why we are here today, to take questions for the public and to educate ourselves about how to prevent the coronavirus, a potential also treatment that may be available, and how we can take care of each other.
Thank you, Mr. Alvarez. It's a pleasure to have you here, and it is really my pleasure serving you as a campaign chairman. Now we're going to hear from Mr. Amadou Diallo. Amadou Diallo is the candidate for District 79. How are you, Mr. Diallo? Okay, it looks like Mr. Diallo is still working on his technical issues. We're going to introduce our doctor, Dr. Arseni Balde. He has his own clinic in the Bronx. He has been serving the community for the past few years. Welcome, Dr. Arseni.
Thank you, Mr. Diallo. Thank you, everyone here. It's an honor for me. I'm really proud to come here, talk about this pandemic. Also in support of the two candidates, Mr. George Alvarez as the New York State Assemblyman, and Mr. Amadou Diallo as a District 79 leader. So it's an honor to be here to give advice, provide advice to our population here in the Bronx, and at the same time support our two candidates. Thank you all of you.
Thank you, Dr. Balde. Now we're going to pass the microphone to our registered nurse, also known at this point as frontline workers. Miss Maria Mabari, welcome.
Hello, good evening, everybody. I greet everybody. I hope everybody in their car doing well. Everybody's
Thank you.
difficult time. It's my pleasure to be here to give some information, support our community. I know it's a tough time right now, but we can get through it. There's still hope as a community. There's a lot we can do to support each other to get through this.
Thank you very much. We are pleased to have you here, and we know you've been working hard to really help our New Yorkers stay safe, or you working to save lives. So we're gonna start with your permission, Mr. Alvarez. We're gonna start with you, so you can tell us a little bit what New Yorkers are facing right now, and before we hear from the doctors.
Look, absolutely. As you all know, as of today, the statistics show that over 200,000 people are infected in New York State. And out of those, 11,000 already died. What is more concerning to me is that 34% of those people are Latinos and Black. So I think that somehow poverty and pollution and neglect, sometimes neglect, right, became the coronavirus formula for disaster in the Bronx. And this is something that concerns me the most. Why are we being now a formula for disaster? And this is because we have the more poor population in the New York City. That's because we have people who are in high risk of getting the disease. And this is all tied. This is all connected to education, poor, well-paid jobs, people with we know good taking care of buildings on their apartment. It's all connected, and we need to find something where we educate our people, where we improve the minority business in the Bronx, and show the people that there is more than just living a project. So my commitment with the 79 population is to let them know enough is enough. We are going to make the real changes. The changes that the population of the 79 Assembly District has been asking for more than 10 decades. Since the foundation of the 79 Assembly District, we've been seeing a lot of people get elected, and none of them fix the real issues. Every time that we go to one of the buildings, to one of the communities, it's the same issues. Buildings are not well taken care, NYCHA is not doing their job, resources are not coming for our school, we have no health care properly applied, right? So that is what is concerning me the most, and that's why we are putting together this team to get advice from them as of what we should do once we get elected to pass a bill to alleviate and once for all fix the situation that is happening in the 79 Assembly District in the Bronx. That's what I want to hear from the doctor, which is an epidemiology. How can we prevent potential outbreak, not just for coronavirus, but for any other virus that may come in the future? Also, what kind of treatment can we have right now for the coronavirus, if there is? And that's what we're putting together, and that's what I want the doctors and the nurse to share their experience on what's happening right now and how we can help now before we get elected and after we get elected, so we can prepare a bill with an expert in the matter that we are facing right now.
Thank you very much, Mr. Alvarez. Before we hear from the doctor, I want to hear from the registered nurse. First, I want to know in which hospital are you working and what your day-to-day look like there.
I work at Monte Medical Center, 233rd, also known as Wakefield. So I am a labor and delivery nurse. So we see a lot of patients come in. Some of them, they don't have symptoms, but right now we're testing all patients that are admitted to the unit because given the when you're pregnant, you are higher risk if you contract this virus. So it's better to catch it early than later. So we test everybody, and we see a lot of patients that turn out positive, even though they don't have symptoms. So that means that a lot of people out there are positive. There's a chance they are spreading this virus without knowing it. So that's why it's important for everybody follow all the CDC recommendations and the World Health Organization recommendations because we still have a lot of work to do. There's a lot of people that are suffering from this virus, and it's very hard and a lot of time heartbreaking when seeing these people suffering and going through this. So we take it one day at a time. It's important to help them to be there for them. A lot of them, the families are not there. But right now, if you go to the labor room, so everybody knows you're allowed to have one person with you because this is a critical time that a woman can go through. We don't want you to be there by yourself. But at the same time, if you go with that person, there's a strict rules that that person has to follow. Otherwise, they may be asked to go home.
Before I pass to the other people, I want to ask you, like I hear a lot of people talking about like the commute from home to workplace and from workplace to home, like how fearful they are meeting people that might be like non-symptomatic carriers. How do you feel? What your like moral look like when going from work to home work?
So every day is a challenge. Every day you have that, worry in your mind. So you're going to work, you don't want to bring anything home, right? So you have to take extra precautions. We all talk about this at work every day. It's something we all worried about. Some of us already have this coronavirus and survive from it, and some of our colleagues not, but still you still have family home. You don't want to bring anything to them. So we take different precautions. So like the same the clothes that we wear from home to work, we don't wear the same clothes to in our work. So sometimes we change twice, just to minimize, bringing everything. And then when we go home, there's a protocol procedure we all take, extra precautions just to make sure you don't make anything, or we wear mask, and different hand washing, you can make off everything, take the shower.
Thank you very much. I think we're hearing another background noise. So thank you for your testimonies. We really appreciate what you're sharing. Now we're going to call Dr. Alseni Balde, who is an epidemiologist. Sorry, I'm not from the health field, but I'll do my best. Dr. Alseni, I don't know if you can hear us. What can you tell us about this disease? How do people contract this disease?
Well, I guess I hear you. Yeah, in terms of public health, we know the means of transmission of contamination of this disease. We know it can be direct contact between the person who's sick and the person who is not sick but susceptible through breathing, talking, coughing, sneezing. But it can also be an indirect contact by touching places, surfaces that had been contaminated by a sick person, either by opening a bus door, the taxi, the train, or just touching a counter. So all of those means facilitate the transmission of the disease. And as the pandemic evolves, we're getting more and more information about other means of transmission.
Thank you very much for sharing that. We had another health professional last time who was talking about the importance of social distancing. How much can you stress the benefit of social distancing to fight this disease?
Yes, Mr. Jallo, this is very important because a disease like this one, like the COVID-19, that has no vaccine to prevent it, that has no treatment, no medicine to treat it. So the best way to really avoid it is the prevention. And social distancing is the method that really, really will help break the cycle, the vicious cycle of the transmission, and help to end this pandemic. And we really, really need to respect those rules, social distancing, stay home, and stay away from each other, particularly when we are outside. And this is the best way to avoid the contamination, further propagation of the disease. So that is very important. This is the single most important method to help break up the cycle, the vicious cycle of the transmission.
Mr. George Alvarez, earlier on your introduction, you were talking about how much Bronx is hit by this pandemic, and as we heard the doctor, social distancing is very important. But you also spoke about how the Latino community and the African American community has been hit by this pandemic. One of the biggest issue that we have in, according to many sources, is the social economic problem, also something related to housing. Many of these minorities live, many of them in the same house, so social distancing within the apartment is not easy. What advice or solution you may have for this problem?
Look, like the doctor said, I mean, our situation here in the Bronx is very critical, especially in the 79 Assembly District, where we have people fighting to get a accessible housing. And I'm trying to change the name from affordable to accessibility, because we are seeing a lot of constructions going on in the district. The problem with that is that it's not accessible to the people of the 79. So the formula that they're using, the formula the city is using right now, is based on the average income for the city. And unfortunately, we don't live in Chelsea. We don't live in those zip code where the resources are coming. We live in an area where the poverty is what you see everywhere, right? So once we get elected, we are going to change that formula. We are going to take the average of the zip code where the people live. We're going to take the average of the salary of the year income of the neighborhood, no the city. And that will make people who live in the district to access those new constructions that are being developed within the district. So right now you see a family of 8 people living in one room apartment. How can they keep the social distance? That's no way that they can do that. So that's one of that's one of our plan once we get elected, to reestablish a new formula for apply to what they call affordable, but I'm going to change that for accessibility.
Thank you very much, Mr. Alvarez. Mr. AHMADOU Diallo, you are candidate for Mayor Leader District 79, and you are very involved within the African community in the Bronx. What have you been hearing as far as concern from the African community when it comes to this pandemic? Yes, Mr. Diallo, can you hear us? I think we might have an audio issue with Mr. Diallo. We're gonna get back to him later on. Mr. Diallo, work on your audio. We are not hearing you. Dr. Balde, with what relation, if any, can you draw between the economic situation and this health issue? What relation, if any, can you draw between them?
Yes, Mr. Jallo, we have all seen, as the Assemblyman, Mr. Alvarez, just indicated, we've seen how this disease is prevalent among our communities here in the Bronx. So, you know, it's like for the past few days, we have seen that, you know, the rates are like twofold or threefold among our communities compared to other zip codes. Why? We know it's not just race. We know it's access to healthcare. We know it's access to health insurance. It's access to medicine. It's access to education. I would say it's really, really economics. That's what makes the difference between, you know, those zip codes, the prevalence of these pandemics. So as Mr. Alvarez also indicated, we have a lot of work to do from now on, because in public health wise, we knew a lot about the distribution of diseases like chronic disease, asthma, diabetes, high blood pressure, etc. But this pandemic has really given us even a challenge, because it amplified all the disparities that existed so far. And I'm glad to see that the CDC, which is the Centers of Disease Control and Prevention, will release data in the next few days, if not weeks, to really show us those disparities between zip codes, between race or gender or etc. Demographics data. This will help us really study more and see what are the causes of those disparities. And this is a challenge for all of us. This team and beyond this team, with the team of Mr. Alvarez, to address for the next few years, to really, really address those issues that have been amplified by this pandemic.
Thank you very much, Doctor. I don't know if we have now Mr. AHMADOU Diallo, if he was able to fix his mic. We were not hearing him earlier. Mr. Diallo, we wanted to know your take in the African community. What, oh, he's not, he's still working. So we're gonna come to the registered nurse. Miss Barry, we have at this point been hearing a lot of situations with like mental issues as far as the healthcare workers are concerned. Have you experienced anything like that, either yourself or your like coworkers or people like that? What can you share as far as mental issue with this pandemic is related?
It's a tough time, but we're taking it one day at a time. Have a lot of our coworkers that gotten sick with this virus, taking care of patients, and even we got some of our coworkers that unfortunately passed away due to the virus. And you know, it's hard, but we try to support each other and get one day at a time. And it has been a lot of support from outside, and the hospitals, you know, they really step up and, you know, giving us support right now as information comes in, as changes happen. Things are getting better, but there's still work to do, work needs to be done. But we're taking it one day at a time. Right now, we're in a crisis, so focus on the crisis, helping people, trying to save as much people as possible, and then everything else will come later.
Thank you very much for sharing that. So, Mr. Barry, I wanted to come back to you, our candidate for the assembly, man, Mr. Alvarez, has been speaking about the housing issue. I know you work in the real estate field. What can you tell us about the challenges for people having access to a good apartment or housing? That's one. Second, what help is available out there for people that are struggling with paying their rent or any other housing issues?
Thank you for having me within the firm. I really appreciate it. Yeah, the housing market. Unfortunately, fortunately, on one side there has been a lot of help with people receiving checks to help them with their daily from the federal government with their daily needs and probably to pay some of the rent. But unfortunately, for New York City, those checks doesn't mean anything. $1,200 doesn't even pay a studio in some neighborhoods in New York City, and unfortunately, also too much unfortunate stuff. The housing market rental hasn't dropped, and the housing market also is stable. It's not going down, not going up either, and the rent is not changing. So the best thing, or the best thing uh, people can do with their landlords is to negotiate with them, see how they can, get a rent forgiveness, or negotiate something with them to make sure they don't have to pay what they cannot afford. Or uh, in right now everything is quiet, the courts are closed, no one can evict someone, none of that. But after the way the system is set up right now, after all of this, after the crisis, uh, people still have, or landlords still have the right to go after tenants, because nothing is there is nothing there to protect tenants. So the best thing we give, the best advice we give tenants right now: talk to your landlord, negotiate with the landlord. Hopefully, the landlord will understand, or hopefully the landlord can afford to forgive you the rent. The other thing also is the mortgages. Landlords doesn't have a break from the mortgages. They still have to pay their mortgage. So it's going to be very difficult for them to forgive. Now you have few good landlords out there. Like I heard on the news the other day, this landlord have 80 tenants, where he forgive all the tenants. If you have a landlord like that, God bless. But if your landlord cannot afford to go a day without, collecting rent, then you definitely want to negotiate with them.
Thank you very much. I also heard like on the public housing, like NYCHA. Is there any program available for tenants in the public housing?
Well, there's rent suspension on larger houses, but it's very few of them out there these days. Other than that, there's not too many stuff. We have seen a lot of groups are doing, trying to be advocate, trying to fight to get the governor or the mayor to do rent suspension, but unfortunately they haven't said a word about it. So it's still the way it is. Nothing has changed on that end yet.
Thank you very much, Mr. Barry. Coming back to Mr. Alvarez. Mr. Alvarez, as Mr. Barry just said, the issue here, we like people might have some break for a couple of weeks or a couple of months until like the crisis finish. However, once that crisis finish, their rent is not forgiven. They have to come up with this rent. So this might be a lot of legal issues coming up. Do you have any idea about other resources available out there for people, whether they are business owners or just tenants inside houses? What resources are available there for people of the Bronx?
Definitely, there is a couple of programs right now that is going to help those tenants, whether they are a resident tenants or business tenants, that will mitigate the situation that they're going to have in the accumulation of 2-3 months rents. Definitely there is program for that, but also more than those programs, we are preparing a packet where that package is going to come to the rescue of the people of the 79 Assembly District. Even though sometimes I don't think that people in the 79 see anyone coming to our rescue, I'm telling them today, this is one of the first team that we are putting together to tell them, hey, look, even though you don't think that anyone is taking care of you, we are. And that's why we're presenting this public health care team together to advise us on how we are going to help them now and before we get elected. Look, I'm going by the numbers right now, while the Queensborough lead the overall death toll in the city with around 1,600 people, right? The Bronx, which has a smaller population and lower case total, right, is dramatically more death per case with 1,185 people death as of April 10, according to the New York City Health, right? Everything is according to the New York City Health Department data. Now, the Bronx is home of more than 60% of the New York City very low income residents. That is the key. The key is our people in the Bronx represent 60% of the whole New York City that has low income. Not just low income, very, very low income. And also what that leads? That leads in hospitalization because of the situation that we are having. And it's a shame that we don't have Mr. Musa on the line, because he's part also of this team of advisor. 6% of the Bronx resident who contracted the COVID-19 died. You hear that? It's 6% of everybody in the Bronx who got the disease died already, right? Making us nearly 1.5 times more likely to get death for the virus than any other county in the city. That made my life poor. That made my life miserable when I read those numbers. And look, in terms of the severity case, the Bronx is carrying the burden right now. I mean, we are the highest county in the city that has the virus right now in terms of per capita population. Now, I heard rumors, and probably the doctor will be able to help us. I heard rumors that they trying to put a temporary hospital in the Bancola Park, the same thing, similar to what I did on Central Park and the Jacoby Center in Manhattan. I don't know if that is going to be a real. They say that within 2-3 weeks, we are going to have the Bancola Park become a temporary hospital. But just one example of how the virus has disproportionately impact minority community around the city and nation. Hispanic are the 34%. It represented 34% of all death in New York City. Right? Wow. We represented 29% of the population, but we represent 34% of every single death in the city. While the African American made up 28%. So between Latinos and African American, we represent right now, guys, 62% of the whole death.
Wow.
So between Latinos and African American, we represent that. So that's high. That's very, very high number. 62% of whole death in the city is represented by Hispanic and African American. Despite that the African American represented 22% of the population of the city, those numbers scare people. Those numbers concern me. So that's why we want to do this. And we're not going to stop doing this. Today is the health. Next time is going to be housing. Next time is going to be public school. And next time is going to be job, right? But those numbers are scary, guys. 62% of all death in the city are represented by Black and Latinos. That's scary.
This is really breaking my heart. It's heartbreaking. So I don't know if our candidate for district leader, Mr. Amadou Diallo, if his mic is working. We had the same problem with Sheikh Musa Drame. He sent me a text saying like he was having a problem with the mic. That's why he didn't get connected. Mr. Diallo, can you hear us? We see you talking, but we cannot hear you. Mr. Diallo? No, we cannot hear you. We still have a problem with your mic. Now, I'm going to go back to Miss Barry, the registered nurse. Miss Barry, what have you been experiencing as far as you heard Mr. Alvarez? 62% of minorities, of people dying are minorities, either from the African American community or from the Latino community. Prior to this pandemic, like the patient that you've been receiving, what proportion of minority were there, and why do you think the death rate in this community, meaning the Latino and the African American community, is too high, in your opinion?
Thank you so much for that. That's a great question. So far, since I've been in healthcare, what I have observed with our people, meaning African American and Spanish, so there's a lot of work that needs to be done. So a lot of time we are playing like catch up, then like get into the beginning of things before things get out of control, right? Meaning that like we need a lot of preventive care. We need access to preventive care, like primary care services, clinic, community clinic, community services, urgent, those things like that. We need access and education, so we know what we're looking for. We know what's out there for us, and how can we get access to that, right? And we have to stay on top of our own health. You don't want to wait until everything like out of control. Now you gotta play catch up, right? So from the beginning, like annual physicals, stay on top of your vaccine, like do all the tests that's required. So you know your body, you know yourself, you know what's going on with you, and you stay on top of it, right? Before somebody is like diagnosed like diabetic. So if you are going to a doctor, there's steps, right? They can catch certain things earlier before you get to that point. They can tell you, okay, your A1C is going up. What's going on here, right? So you can catch that early. You can do diet, exercise, weight loss before you get to getting diabetes. That's preventive healthcare. That's what we need. We need to educate our community and have a lot of access preventive healthcare, so we're not playing catch up. So a lot of our people, it's sad to say we don't have those services available, and the lack of resources and education also affect it. But if you look at also the population, a lot of people have comorbidities like diabetes, hypertension, asthma, obesity. Those are big, comorbidities that play huge, um, huge part in a lot of these, especially this coronavirus. It creates complications. So if we stay on top of this, control this before it gets to that point, we're not playing catch up. So preventive health is very important. So and education to our community.
Thank you very much, Miss Barry. Dr. Balde, if you were to give 3 advices to people, actually, I don't want to put a number. What advices are you going to give people as far as staying safe from the coronavirus? That's 1. 2, preventing any chronic disease.
Yes, Mr. Jallo. Right now, as I said before, the epidemic is here already. COVID-19 is here already. So all we can do right now, not to, for those who've been lucky not to catch the disease, is to stay away from other people as much as they can, meaning applying social distancing. Because right now we don't know who harbored the virus, who carries the virus, who doesn't, because even asymptomatic people who don't have symptoms can still transmit the virus and transmit it to other people. So the best way to avoid catching the disease is to stay home if possible, or stay away from other people, leave a distance between a person with other people to avoid the transmission. But I will touch one area.
All right. It looked like we just lost Dr. Balde. It might be like somebody came on his line. Mr.
Indicated
Alvarez.
The
Oh,
high
okay. He's back.
percentage of Mr. Alvarez has indicated the high percentage of death among our community here in the Bronx. I would say this is the end results of something that happened before at the beginning of the epidemics. We all know that there were less testing centers here in the Bronx. So when the epidemics arrived, the best way at that time to avoid that it spread in the community is to test all sick people, test the contact, isolate them, put them in quarantine to avoid the spread, the dissemination of the disease in the community. In the Bronx, we didn't have enough testing centers. So sick people who've been in contact with those sick people were left alone, going back to the community and contaminating other people. That's why I'm saying this high percentage of death and disease in the Bronx is just the end results of what happened at the beginning of the epidemics. Right now, we all need to avoid, contacting the disease. But very important, at the end, when we get this curve, after the curve flattens, we need to work more in getting those test centers in the Bronx, because at that time, right now, there are cases, the disease is everywhere. There's not much we can do but social distancing. But when the curve becomes flat, we really need to fight to get more test centers in the Bronx. So the few cases we will have at that time will be isolated. The contact people will be traced and isolated, put in quarantine to avoid from the disease to come back. Because if you don't have those test centers, the few people who will become sick will again spread the disease, and it's gonna linger, it's gonna persist for weeks and for months. So I think this is the right time to take all our disposition to fight to get more test centers in the Bronx to avoid again the same process, the same problem that we had at the beginning. Thank you, Mr. Jallo.
That is a very important point you just mentioned. I really didn't know that there is lack of testing centers. But before I let you go, I wanted to ask you about something related to traditional medicine. Right now, since this coronavirus came, there are a lot of doctors on Facebook or on the social media. See people advising about lemon, garlic, and many other things. What advices can you give to people?
I don't hear you, Mr. Jallo.
I said, like, there are a lot of doctors giving, meaning fake doctors, talking about traditional medicine such as garlic, lemon, orange peels, and things like that. What advice do you have to give as a professional of health when it comes to these traditional medicine to fight coronavirus? Can you hear me, doctor? I think Dr. Balde might have a sound issue. He may not be hearing us. So we're going to come back to Mr. AHMADOU Diallo. I don't know if he can hear us now. Oh, he's not even connected. Mr. George Alvarez, is there anything you as a candidate can do right now to help people in the Bronx get more testing centers? Is there anything you can do about that?
Well, right now, we are doing a lot. We are doing a lot because it's our social. I would say social responsibility. Even though we are no elected official yet, we are doing a lot. We are being distributing food for the people since the disease start. We've been servicing more than 500 units every single day. We've been very active calling when people are getting situation with NYCHA. We've been open ticket on their behalf. And another thing that we are doing is putting together a TNA expert, a TNA professional to advise us on what we should do. Remember, I'm not a doctor. This is a public health situation where we need to have advice from experts, and that's what we're doing together. That's what we're putting together: doctor, nurse, someone for housing specialist, yourself. That's what we're having a natural medicine expert. That's what we're having our distributed candidate, and that's what we're doing. We're putting together our plan on how to help the people right now. The only thing that we can do is start, studying the data, run the numbers, and make sure that the public knows the numbers. I mean, it's 62% of the population that is dying for the coronavirus is minority, is Latino, or is Black. I mean, why is happening? And all that has one reason. All that has one connection, like they said. Right now, is the poverty, is the less access to the resources that those rich people have access to that we don't. And that's what we care. That's what we're trying to do here. We're trying to put a team of experts to help us to keep advising the population and trying to push those people in power to bring more testing center to the Bronx and see if everybody can be tested. I know it's tough. I know that it's not just the Bronx, it's everybody right now, in not just in USA, but I think in the whole world. We know that, but honestly, I'm care about the people that I know. And this is the people of the Bronx, people of the 79 Assembly District. And this is the people that I'm looking to represent. So that's my priority right now.
So I have a question that I want all three of you to weigh in. Basically, actually, all everyone, if you have an opinion. Since I have you, George, I'm going to start with you. Does policy have anything to do with the expansion of this disease in the United States compared to other countries? I don't know if you heard the question. Does policies have anything to do with the expansion of this disease in the United States compared to other countries? Mr. George Alvarez.
I think that more than a policy is politic.
Okay.
Policy is one thing that is being defined by politicians. I think it's more politics things than human things, right? And you see the fight right now between the president and some of the governors. Well, the president say, "Hey, you know what? I'm going to reopen the country, the country, the nation." And some of the governors say, "No." I mean, it's time to go to analyze the data and see the reality of the people, on top of the politics. And I believe that the issue is more politics than policy.
Thank you very much. Dr. Balde, what is your take on the same question?
Yeah, I would say it's really, we all know the story behind this disease, behind these pandemics. We had enough lead time from the time the epidemic started in China to the time it hit our country. We did have some lead time. So we had enough time to really prepare some logistics and get ready. We know somehow that did not happen. So, that's why, the few cases we had in the beginning, not all of them were tested. So then they had contacts, they disseminated disease in the community. So the transmission came from few people, it went into the community. So I would say, yes, it has many factors led to the situation where we are at right now.
Thank you very much, Doctor. Miss Barry, same question. Does policies have anything to do with the expansion of this? I need your opinion on this as well.
I would say like this is a new disease, and every day is a learning process. We learn as we go, so it's very important for all of us to keep up with the CDC, their recommendations, because it's even for them, every day they're learning. It's not like this is happening before. There's like a research, everybody's learning, researchers, everybody, as things happen, we're learning more information. So we try to follow CDC recommendations and guidelines. So of course we started late, so we just do what we can and follow recommendation and stay on top of everything.
Thank you, Mr. Barry. You are the last one that I want to wait on this question because, to me, like many of you said, policies have a lot to do with the growth of the cases in the United States.
Well, absolutely. But unfortunately, I'm in a very bad position to speak about that since it's politics and I'm not a good politician. I would love to bring my, give my opinion on real estate. But at this point of time, since we're running out of time, maybe it's best if we have a couple of people watching us asking questions. I don't know if we want Mr. Alvarez to, address those questions.
Yes,
I think
you're right.
it's very very good that we answer some of the questions that the audience may have.
It's a lady by the name of Aminata Debeya Diallo. She's asking you that question. What about those who have no government services applied and only one spouse in the house is working minimum wage at the moment with 5 kids and none of them are working neither? There is nothing for those people, for these people?
Well, Aminata, I know your concern. This is not something that just affecting you. It's most of the population in the Bronx has the same situation as you. We do have a plan for that. I know it's very hard. I know the situation. We do have a plan for people like you. It's not just you. It's a lot of people. We every day before the pandemic we receive a lot of calls about the same situation, and that's what we say. Next week we're gonna have a plan. We're gonna have the team and the plan of how to help people to those entrepreneurs to start their own business, help them to get the funds that are available for a new business. And your situation is like most of the people in the Bronx, but we do have a plan for you.
All right, we have a next question from George Paris. I don't understand this question. You might want to take a look at it.
He said, have the nature building in the 79 Assembly District been wiped down? Is there any confirmation of what happened?
Well, John is a candidate for the Senate. Is part of our group. John, I don't know if you saw recently a group of NYCHA employees are supposed to do that rather than do their job. They were hanging out outside in the front yard of the building. So I have no confirmation. I don't think that it's been happening. I don't think it's been happening, honestly. And I don't know how it will be happen because you have to evacuate everybody from their house to do that. I don't think so.
All right. John also have another information you want to share with us that there's a thief just inside at the Bronx Zoo. They say you have to make an appointment though. So just
and yes, we have that. We have another one in Grand Concourse. At some point initially when the virus started coming into the city, they opened a drive-through testing center in Lehman College. Yes, we know that, but it's not enough. And it's not just me saying, but is the governor saying, is the mayor saying, is every single person who knows the magnitude of this situation understand that, yes, we have sun, but that is not enough. It's not enough for a testing center that has a capacity to test 200 people every day 500 people max every day, where we have approximately 1.4 million people in the Bronx.
I see. Thank you very much. Any other Facebook questions, Mr. Barry, or shall we go to?
Those are the best we have right now. We have Mr. Diallo back on the line, but we don't know if he have the mic.
Mr. Diallo, the district leader, can you hear us?
No, he is having a mic problem. So
yes, he's been having a mic issue the whole day. Yeah. Dr. Balde, I asked you earlier, but you also had a microphone issue about this traditional medicine. Since the coronavirus started, we've been seeing a lot of new doctors without degree, advising about sometime lemon peel or lemon, garlic, and orange peel, or many other things. What can you tell us about the traditional medicine as far as fighting coronavirus?
As of now,
yes, go ahead. Yes.
As of now, there is no medicine that have been approved for the treatment of COVID-19, and not a single medicine has really shown effect in treating and killing the virus. Even though hydroxychloroquine is being used, many studies are still pending. They are in process. The results are not out. And until we get results about all the candidate medicine, so far there is no medicine that's effective. People are using different remedies to try to, ease their pain, the fever, and whatnot. If they work, fine, but there's no single scientific study that has, demonstrated that one medicine is effective, safe in eradicating the disease, in treating the disease. As of the vaccine, same thing. There are trials going on to try to get a vaccine, but so far there's no vaccine that have been approved.
All right, thank you very much. So I'm going to pass back the microphone to Mr. George Alvarez. We're going to do a round. We heading toward the end of this broadcast. So, Mr. Alvarez, what can you tell our people who are seeing us, listening to us, as far as a candidate of District 79 for Assemblyman? What can you tell them before, as far as this virus is concerned, before we go?
Well, basically, exactly what the doctors are saying. I mean, we have to keep the social distance. We have to, as much as possible, because we know the situation in the Bronx. We know the situation in the poor communities, where even though we have to say that we have to keep the social distance, it's not possible. It's not possible to. That lady right now says she got 5 kids and a husband and her. That's 7 people in an apartment. How can you ask her, look, you have to keep the social distance? There's no way. That is humane. That is insanity to say something like that, right? But as much as you can, keep the social distance, follow the guidelines, follow the doctor recommendation, and just keep in mind you have someone who care about you, and that's why we have the doctor, the nurse, Mr. Varid, AHMADOU, that for some reason he has some technical difficulties, and that's my best advice. We have someone who care about you, and this is the entire team that you're seeing right now that is working for you. Even though you don't see us every single day in the front line, we are working for you.
Thank you very much, Ms. Alvarez. Ms. Barry, what can you tell people as far as advice on before we end this show?
Okay, I would tell everybody it's the same thing we've been saying from the beginning. Social distancing, hand washing. People lately, something I know when outside or anything, people have been wearing gloves all over the place. Sometimes you see people, they have their gloves, they're touching their face, they have their phone, some of them even eating with those gloves. So we have to be mindful. We don't want these gloves replacing hand washing. Hand hygiene is one of the best thing we can do. So be mindful with the gloves. So if you're gonna wear gloves, do something. You first take them off, carry hand sanitizer, or use soap and water, wash your hands, dry them. Because if you touch anything with those gloves, you touch your face or you touch your eyes, that's how this virus, is transmitted. Somebody maybe touch that place and then you come in with your gloves, you touch, you're not washing those gloves, you're not sanitizing those gloves, and you touch it. That's for everybody something to keep in mind. You can carry a hand sanitizer. If you're outside, sanitize your hands. Be mindful people around you, what you touch, and where you sit, stuff like that. Be very extra careful. Social distance. Um, if anybody home right now not feeling well, sick, hydration is recommended. If you're having pain, um, you know, I don't know, if you're having trouble breathing, go to the hospital. There's always people there that are willing, to take care of people if you're having problem breathing anything. So.
Thank you very much for that. Dr. Balde, same question. What advice can you give people about the prevention or what to do if you suspect yourself that you might have a virus?
Yeah, the prevention, we talked about that already. The main thing is, to do personal hygiene, washing the hands, avoiding touching places and touching the face, and applying social distancing as much as we can do. It's not easy, it's true, but unfortunately, or fortunately, that's the only best way to avoid the propagation of the disease. But what I wanted to add here, right now, the epidemics is here. The disease is everywhere. So all we can do right now is to prevent the people who didn't catch the disease from catching it. And people who are sick, to get care. And we hope, we pray that they get better. But this is really the right time to fight for the community, to fight for the Bronx, to have more testing centers. Because this is the key issue to really, when the curve, we flatten the curve, there are less new cases. This is the best way to prevent us from repeating the same process, the same thing that happened before. To maintain that curve down, flat, to avoid any more new peaks, more curves, we need to have more testing centers to detect people who are sick and to prevent them from going back to their families, to the society, and continue the transmission of this disease. I think Mr. Alvarez is doing the right thing right now. We all need to support him because this is really what any community leader need to do the same thing that he's doing. Not only provide the information, counseling to our community members, to the Bronx, but also have the right team to address the issues and really to pinpoint what area need to be worked on to have more effect in preventing future epidemics in our community, to try to get rid of these huge disparities in new cases and new deaths. Because race alone is not the factor why we are having more patients, more sick people, and more death. Race alone is not the issue. The issue is access to care. It's economic, access to different resources in the community. And as I said before, these pandemics, this COVID-19 has really amplified all the disparities that existed. We all knew that we have more chronic disease among us in our zip codes. But COVID-19 has really opened our eyes even more than before. We all really need to rise and work together and try to fight this and to really, really fight to lessen these disparities in our society.
Thank you very much, Doctor. Mr. Barry, for those who might have issues with their rent or with their landlord, what advice do you give them?
Like I was saying earlier, we advise people at this point of time. We thank Mr. John members, because he's really a community leader and he's a fighter just before politics. Now he's into politics. You know, we will have to push him and support him until he gets the job, so he will continue his fight. Now, in terms of the renters, unfortunately, there is nothing there is nothing to protect renters. And we have, like he said earlier, 60% of the poverty or the poorest people is in our community, is in the Bronx, you know, and there's nothing to protect them from not being kicked out after the state of emergencies is lifted. Right now, it's suspended, but it's going to be lifted sooner or later. Now, after it's lifted, what are the people going to do? So we really need our leaders to help us protect that, because at this point of time, there is no protection for the renters. All what we can advise renters right now is to negotiate with the landlord, talk to the landlord, you know, tell him your situation, see if they can help you. So that's my final advice for that. I thank you very much for having me.
And
Thank you.
on the conference.
Thank you very much, and we thank our panelist, Mr. George Alvarez. We also thank Dr. Alcedi Balde and Miss Barry, our registered nurse. We really apologize and for those who were invited that they were not able to make it. I'm talking about Sheikh Musa Drame, that is a community leader, and Mr. Amadou Diallo, that is a candidate of for male district leader in the District 79. Now, as far as I'm concerned, you heard the advices given by our professional, our community leaders, and many other people. If you are in doubt, if you want to find out if there is any help available out there that you may not know about, just call 311. They might have information, like call them, ask your question. Let's see if there is any resource available for you. We know the federal government is working on sending $1,200 to those who filed their taxes or who made the request. We know the SBA is doing everything they can to provide support to business owners. You may not know or how to have access to this benefit or any other thing. Call 311 and then they will help you. Or you can call the campaign for Mr. George Alvarez. Next time, we're going to provide the numbers. You can just go on Facebook and look for George Alvarez. You're going to see him there. Send questions, or like his Facebook page, send your questions through that. Until next time, it's been my pleasure hosting this show today. I wish you a nice evening. Stay home, stay safe, wash your hand, wear mask if you're going out, wear gloves if you're going out. Thank you very much.